Hello, I made this short playlist to walk you through everything you need to know about going on Medicare at 65. Medicare is a federal program that provides health insurance to people age 65 and older and to certain individuals with disabilities or qualifying health conditions. If you qualified for Medicare under 65 due to a disability, it will continue when you turn 65 and you don't need to re-enroll in original Medicare. If you are aging into Medicare at 65, the parts of Medicare that you decide to enroll in will largely depend on whether you are retiring or still working. Many people work well past age 65 these days, so if that includes you, you'll want to remember that the size of the employer is what matters most. If you work for a large employer with 20 or more employees, your employer coverage will remain primary and your Medicare will be secondary. In that scenario, many people will delay Medicare Parts B and D since both of those parts require you to pay monthly premiums. You probably don't want to pay premiums for Parts B and D when your employer coverage that is primary already provides you with outpatient coverage and drug coverage. There's no rule against doing so, it just might be more coverage than what you need. So when you still have active large employer coverage, you can safely delay enrollment into those parts until you retire without penalty. Check out our videos on Medicare and employer coverage for more information on this, especially if you contribute to a health savings account, because you'll have some decisions to make on whether to enroll in Medicare Part A. On the other hand, if you work for a small employer with less than 20 employees, Medicare will be your primary coverage and your employer coverage will be secondary. You'll want to sign up for Medicare to start when you turn 65, or else you may face unexpected medical bills and a late penalty for Part B to boot. Sometimes small employer coverage is costly as well, so if that's the case for you, give us a call here at Boomer Benefits so we can help you compare the cost of your secondary small employer group coverage against private options like Medicare, Medigap, and Medicare Advantage, which may be more cost effective. Our service is free. Now let's move on to people who actively retire. Retirees who don't sign up for Medicare when they first become eligible can suffer late penalties. And if you have retiree health coverage from an employer or TRICARE for Life, Medicare will be your primary coverage. So you'll want to sign up for both Medicare Parts A and B during your initial enrollment period. Likewise, if your income is below the threshold and you qualify for Medicaid, Medicare Parts A and B will be primary and Medicaid will be secondary. Depending on the level of your Medicaid, such as QMB or SLMB, Medicaid may help you to pay for your Part B premiums through one of the Medicare savings programs. Check with your state's Department of Health and Human Services to find more information on how that works in your state. Some of you watching this video may already be retired before age 65, and you currently have a health plan through the Affordable Care Act Marketplace Exchange. Individual ACA health plans through the Healthcare Exchange are generally not creditable for delaying Medicare, so that means you need to leave your ACA plan at 65 and enroll in Medicare Parts A and B to avoid late penalties down the road. Since Medicare is primary in all of these retiring at 65 scenarios, in this next video, I'll walk you through how and when to sign up for Medicare at 65 when Medicare will be your primary coverage.